Hello guys, welcome to online MBBS, and today we are gonna learn about HIV/AIDS, which is a very deadly disease because still now it hasn't got any cure. That is, it cannot be cured 100%. And now it's October 2018, and you can see here this red ribbon, HIV/AIDS red ribbon. This symbol is for solidarity with HIV positive people and those living with HIV/AIDS. Okay, so now let's get started. So first, let's know the introduction about HIV/AIDS. HIV/AIDS, which stands for Human Immunodeficiency Virus and Acquired Immune Deficiency Syndrome, is an infectious disease caused by infection with human immunodeficiency virus, which is also known as HIV virus. AIDS is a chronic, potentially life-threatening condition caused by HIV. By damaging the immune system, HIV interferes with infected person's ability to fight any other organisms and disease. What HIV actually do is it damages the immune system, and due to this they can't fight against other disease and they mainly die due to that disease. And you can see here in this third point, AIDS patients are most commonly complicated with tuberculosis and pneumonia. This tuberculosis and pneumonia are the most common complications AIDS patients have, and they are the leading cause of death among them. So AIDS patients mainly die due to tuberculosis and pneumonia. Okay, you can see here the prevalence. Estimated HIV/AIDS prevalence among young adults, that is from 15 to 49 age group by country as of 2014. This is the statistic of 2014. And you can see here in this picture, AIDS is more common in this southern Africa part. Now we learn about the etiology or cause of HIV/AIDS. So AIDS is caused by HIV virus, which stands for Human Immunodeficiency Virus. It can spread through any of the following, that is unprotected sexual contact, including vaginal, anal and oral, or blood transfusion with infected person, or from infected mother to child during pregnancy, childbirth or breastfeeding. Now let's know what HIV virus is. HIV is a retrovirus. A retrovirus is a ribonucleic acid, that is RNA virus, that must reverse to the deoxyribonucleic acid DNA before reproducing or replicating. It is icosahedral, that is 20-sided enveloped virus of the genus lentivirus of family Retroviridae. Infections caused by lentivirus are mainly of long incubation period. Therefore, due to long incubation period, AIDS patient doesn't show the symptoms very soon. So many people suffering from AIDS, they don't know that they are suffering from AIDS because they don't show the symptoms very soon. It takes very long time. Some takes years, to show the symptoms. Now you can see here this third point. HIV primarily infects the components of the human immune system such as CD4 plus T cells, macrophage and dendritic cells. It most commonly destroys the CD4 plus T cells. Now types of HIV. It's mainly of there are two types of HIV. They are HIV-1 and HIV-2. HIV-1 is the virus that was originally discovered. It is more virulent, more infective, and cause of majority HIV infections globally. Comparison of HIV species. There, HIV-1 has high virulence, high infectivity, and it is present throughout, that is global, and inferred origin is common chimpanzee. Whereas HIV-2 virulence is low, infectivity is low, and prevalence it is mainly in the Western Africa. Okay, and inferred origin is Sooty Mangave. It is a kind of monkey mainly found in the Ghana region. Okay, Ghana. So how does HIV gets transmitted and how it doesn't get transmitted? Okay, so gets transmitted by unprotected sex between homosexual. What homosexual is? Homosexual means of same sex, whereas heterosexuals are of two different sexes. That is between male and female, whereas homosexual is between male and male or between female to female. Either vaginal, anal or oral. where, among these three, anal is the most dangerous. It can easily get transmitted. This HIV virus can easily get transmitted when they have anal sex, and it's more common between the homosexual partners, and mainly between male and male partners. It's very easy to get transmitted HIV virus. And the other is sharing infected syringe or drug paraphernalia. What drug paraphernalia is? Maybe you guys don't know. Drug paraphernalia means any equipment or product or any drugs that is using typically for recreational purpose. So, for example, many people take drug. So the drug, let it be cocaine, marijuana, heroin, and the syringe they take, that comes under this drug paraphernalia. The how other it gets transmitted is infected mother to child. If a mother is suffering from HIV/AIDS, and if she deliver a baby, give birth to a baby, then the baby also can get HIV/AIDS, either during delivery or breastfeeding. Now let's see how HIV/AIDS doesn't get transmitted. That is, many people fear that HIV/AIDS can get transmitted through this, but it doesn't get transmitted through this. That is sharing foods and clothes, such as towel or comb. Handshaking. HIV/AIDS doesn't transmit through handshaking, kissing, and hugging. And also it doesn't get transmitted through mosquitoes bite. You guys may be confused that if HIV/AIDS can get transmitted by blood transfusion, why it doesn't get transmitted through mosquito bite? Because of the low viral load. To cause any disease, the viral load should be greater, and HIV/AIDS, if the viral load is low, it cannot cause the disease. So the viral load is not enough. If the mosquito even carry the HIV virus and bite to a healthy person by flies or insect bites, because of very low viral load, I said you. And sneezing, air or water sharing. That is, if a patient is suffering from HIV/AIDS and if he sneezes, the person around that doesn't get HIV/AIDS. Signs and symptoms of HIV/AIDS. Due to its very long incubation period, many people with HIV do not know they are infected. I said you, it has got a very long incubation period. HIV infection progress in three very general stages. They are: stage 1, acute HIV infection; stage 2 is clinical latency stage, that is HIV dormancy. During this period, the HIV virus remain dormant. And stage 3 is AIDS, that is, during stage 3, HIV AIDS patient shows the symptoms and is considered as AIDS in the stage 3. Okay, now let's learn about stage 1, which is also known as acute HIV infection. Many people do not develop signs or symptoms at all after they are infected with HIV, while others will develop in the first 2 or 4 weeks during this stage 1. And the signs and symptoms include flu-like or mononucleosis-like illness, and this is the most common, fever and headache, swollen lymph nodes in the neck and groin, weight loss, night sweating, rash that may come and go quickly. Now comes the stage 2, which is also known as clinical latency stage. After the acute infection, the virus appears to become more dormant. Dormant means it hides and doesn't show any symptoms during this stage, and the person feels normal during this stage. The stage of HIV infection may last an average of 8 to 10 years. 8 to 10 years, okay, you can see. But it can vary among individuals and strains of HIV, but it varies person to person. In some people, persistent swelling of lymph nodes occur during this stage. Otherwise, there are no specific signs and symptoms. During the latent period, the virus continues to multiply actively. It infects and destroys the WBCs, most commonly this CD4 cells and T helper cells. In the stage 2 again, Even though the person has no symptoms during this stage, he or she is contagious, that is, can pass HIV to other through these transmissible routes. So stage 2, even though during this stage the person has no symptoms, but he or she can transfer the HIV virus to other healthy person. At the end of this stage, as the virus overwhelms the CD4 cells, HIV viral load starts to rise and CD4 cell count begins to drop. As this happens, the person may begin to have symptoms as the virus level increases in the body. This welcomes the third stage, which is also known as AIDS. AIDS is the later stage of HIV infection, when the body is losing T cells and its ability to fight infections. Once the CD4 cells count falls below low enough, that is under 500 cells per ml, an infected person is said to have AIDS or HIV disease. The infections that occur with AIDS are called opportunistic infections because they take advantage of the opportunity to infect a weakened host. Examples are tuberculosis, pneumonia, toxoplasmosis. These are the most common opportunistic infections that occurs to AIDS patient. Laboratory confirmation. So in lab confirmation, stage 1, there is lab confirmation of HIV infection and CD4 count of more than 500 microliter or CD4 percentage of more than or equal to 29. Clinical evidence non-required. And in stage 2, you can see here the CD4 count is between 200 to 499 microliter and CD4 percentage is more than equal to 14 to 28. Whereas stage 3, CD4 count of less than 200 micron liter or CD4 percentage of less than 14. So in stage 3, you can see here the CD4 count has decreased a lot, that is less than 200. Treatment. There is still no cure for HIV AIDS, but in recent times many drugs have become available which has significantly reduced the HIV related complications and death and help to survive a longer life. And there is a movie, if you guys like watching movie, called Dallas Buyers Club. In that movie, the person has got AIDS, and the doctor says that he can survive a long, maybe 1 month or 2 months, but at the end he survived for more than 10 years, more than 10 or 20 years. I forgot, I watched it long ago. Okay, now let's come to this second point. The drugs are given mainly in combined form. At least 3 drugs are combined for effective treatment to suppress the virus from replicating and boost the immune system. When several such drugs, typically 3 or 4, are taken in combination, the approach is known as highly active antiretroviral therapy or HART. So the classes of drugs are antiretroviral. Drugs are broadly classified by the phase of retrovirus life cycle that the drug inhibits. They are reverse transcriptase inhibitors, protease inhibitors, integrase inhibitors, entry inhibitors, or also known as fusion inhibitors, and maturation inhibitors. So now let's learn about the reverse transcriptase inhibitors. This comes in 3 forms. They are nucleoside analog reverse transcriptase inhibitors, also known as NARTIs or NRTIs, nucleotide analog reverse transcriptase inhibitors, NTARTIs or NTRTIs, and the last one is non-nucleoside reverse transcriptase inhibitors, NNRTIs. You can remember this short form because later I am going to use this short form. Okay. Mechanism. How HIV how these drugs act. Okay. When HIV infects a cell, reverse transcriptase copies the viral single-stranded RNA genome into a double-stranded viral DNA. The viral DNA is then integrated into the host chromosomal DNA, which then allows host cellular process such as transcription and translation to reproduce the virus. RTIs. that is reverse transcriptase inhibitors, block reverse transcriptase enzymatic function and prevent completion of synthesis of the double-stranded viral DNA, thus preventing HIV from multiplying. So this is the mechanism, okay, how the drug acts. Now comes zidovudin, azithromycin, AZT. AZT was the first approved treatment for HIV, sold under the names Retrovir and Retrovis. AZT use was a major breakthrough in AIDS therapy in the 1990s. AZT, that is azithromycin, slows HIV spread significantly but does not stop it entirely. Okay. Tenofovir disoproxil fumarate belongs to a class of antiretroviral drugs known as nucleotide analog reverse transcriptase inhibitors (NRTIs), which block reverse transcriptase, an enzyme crucial to viral production in HIV infected people. Then comes efavirenz, brand name is Sustiva or Stocrin. It is a class of NNRTI. As I said, NNRTI is non-nucleotide reverse transcriptase inhibitors. Unlike NRTIs, which bind at the enzyme's active site, NNRTIs, that is non-nucleoside reverse transcriptase inhibitors, act allosterically by binding to a distinct site away from the active site known as the NNRTI pocket. Protease inhibitors. Protease inhibitors prevent viral replication by inhibiting the activity of protease. Protease inhibitors were the second class of antiretroviral drugs developed. Saquinavir. Okay, let's go a little fast. Okay, these drugs. Saquinavir was the first protease inhibitors and sixth antiretroviral approved by the Food and Drug Administration. These were the first protease inhibitor and sixth antiretroviral drug by FDA, approved by FDA. HIV protease is vital for both viral replication within the cells and release of mature viral particles from an infected cell. Saquinavir inhibits both HIV1 and HIV2 proteases. Integrase inhibitors. Integrase inhibitors are a class of antiretroviral drugs designed to block the action of integrase, a viral enzyme that inserts the viral genome into the DNA of the host cells. Raltegravir. The brand name is Isentress. Raltegravir targets the integrase NHIB in the enzyme that integrates the viral genetic material into human chromosomes, a critical step in the pathogenesis of HIV. The drug is metabolized away via glucuronidation. Entry inhibitors. Entry inhibitors, also known as fusion inhibitors. This class of drugs interferes with the binding, fusion and entry of NHIV virion to a human cell. By blocking this step in HIV replication cycle, such agents slow the progression from HIV infection to AIDS. Example is Maraviroc. And you can see here in this picture, an HIV virion binds to a CD4 plus human cell. The two bottom pictures depicts two proposed model of HIV fusion with the cell. Follow-up. People with HIV infection should be under the care of a physician who is experienced in treating HIV infection. This is of infectious disease subspecialist. All people with HIV should be counseled about avoiding the spread of the disease. Infected individuals are also educated about the disease process and attempts are made to improve the quality of their life. Now, prevention. How to prevent the HIV/AIDS? Use of condoms during sex. This is the most common and most easy to prevent the HIV/AIDS. Avoid intercourse with multiple partners, sex workers, and addicted drug users and those who already are infected with HIV. So you need to avoid intercourse with those who already have HIV and avoid use needles and syringe. Avoid breastfeeding by mothers who are infected. And during pregnancy, infected mother can reduce risk of transmitting virus to baby by keeping herself healthy and learn about HIV/AIDS and be aware of its consequences. So these are how you can prevent HIV/AIDS. Okay, thank you. Stay safe, stay healthy, and stay alive. If you like the video, please subscribe, and if you have any suggestion, please suggest in the comment box. Thank you.